I've been asked just to give a quick summary of the shared decision-making bill that recently was passed here in Massachusetts. Our Governor Deval Patrick signed it on August 6th, and it is to become effective 90 days later, so November 6th it will be law. And what's interesting about the bill, it has a few provisions I think are worth mentioning for those of us who are interested in the shared decision-making community. The first is it establishes standards for certification for patient-centered medical homes, and shared decision-making is one of those criteria. It states essentially encourage shared decision-making for preference-sensitive conditions such as back pain, early-stage hip and breast cancers, hip osteoarthritis, cataracts, and it also says it may also be used for long-term care services and supports in palliative care. The second sort of standard or criteria that's of interest to us is that it says that accountable care organizations have also got to do shared decision making, and it mentions engaging patients in shared decision making, including but not limited to shared decision making on palliative care and long-term care services and supports. So this is not a limiting list, it's essentially a list that can expand. Then the third thing they're going to do is they're going to create what's called a health policy commission, which is going to try to compare entities, hospitals, providers around issues of cost, quality, access. And they're also going to establish a consumer website where consumers will be able to go and get access around issues of quality and costs and do hopefully an apples to apples comparison. That will be a big challenge, but nevertheless a worthy enterprise. And the consumer website is also supposed to have information there around patient decision aids and access to them. So for those of us in the shared decision-making community, this is another example of a state taking a step forward, using its regulatory powers to promote change and become more patient-centered.